Today is the first day of open enrollment for Medicare, a service used by 67 million Americans. As Minnesota seniors get ready to apply for benefits, regional leaders explained how new benefits could offer a different kind of coverage this year. Valley News Team's Quinn Gorham reports.
The Inflation Reduction Act passed in 2022 is still relatively new. This year, some new provisions under the law might be worth a second look for seniors, as some of the benefits could impact the way that people access prescriptions. Local Medicare advocates, including the regional director of the U.S. Department of Health and Human Services, rifled through those benefits on Tuesday. Changes to drug prices and purchases have had by far the biggest impact on Medicare. Namely, the cost of insulin is capped at $35 per month. The government can also now negotiate lower prices for certain prescription drugs. Both of those have been in effect for at least a few months now, but a new provision going into effect next January would cap the total out-of-pocket cost for all prescription drugs at $2,000 annually. HHS Regional Director Michael Carbonargi says they project an immediate impact.
3.2 million seniors on Medicare who are expected to reach the cap in 2025 will save an average of $1,500 per year on out-of-pocket costs.
HHS projects that by 2029, 4.1 million enrollees will benefit from the new caps. While the federal government is already negotiating down drug prices on several prescription drugs, those new costs won't take effect until 2026. Once they do, HHS projects that it will save seniors an estimated $1.5 billion in the first year. Reporting in St. Paul, I'm Quinn Gorham.
The open enrollment period for Medicare ends on December 7th.